Hey, my name is Mary Franklin and I'm going to be the nurse today. The first thing that I'll do when I walk in the room is I'm going to wash my hands. Okay, from there I'm going to identify the patient with the two identification methods. So the first that I'll do is I'll scan the barcode on his armband, and then this will come onto the electronic MAR. And the second thing that I'll do is I'll confirm this information with the patient by asking his name and date of birth.
Richard McCarthy, 12/11/53.
Okay, so the next thing that I'll do is I'm going to check the allergies that are listed on the MAR. And right here it says that he has no listed allergies, but you still need to confirm with the patient. So can you tell me, do you have any allergies?
No.
Okay, now I can start the injections. First thing that I'll do is I'll put on my gloves. So the first injection that I'm going to be giving today is a subcutaneous injection of insulin. The recommended dose for insulin is the recommended dose for insulin is determined by the patient's blood glucose levels, but it's usually between 0.5 and 1 units per kilogram per day, subcut into 3 or more divided dosages. So I'll need to look up the patient's blood glucose levels, and it says this morning that it was 322. After doing the calculation, I'll know to administer 11 units of insulin to the patient. The side effects of insulin are hypoglycemia, hypokalemia, and anaphylaxis. Because this is a subcutaneous injection, I'll either be giving it in the back of the arm, the upper back, the glutes, or the abdomen, and I'll be giving this in the abdomen. So the first thing you'll do is you'll clean this in an outward circular motion. And then you'll get the syringe and take off the cap. And so for a subcutaneous injection, you'll grab the skin with your non-dominant hand. Once you do that, you'll inject the needle with your dominant hand, release the skin, and with your non-dominant hand, you'll steady the needle. From there, you'll press the medication in and then remove it at the same 45 to 90 degree angle that you first put it in. Then you'll clean the injection site with either a cotton ball or a pad. Okay, so the next injection that I'm going to be giving is an IM injection of ceftriaxone sodium. So the recommended range is 1 to 2 grams, and I will be giving 1 milliliter every 12 hours. The side effects of this medication is leukopenia, anaphylaxis, diarrhea, and seizures. Before you administer, you need to make sure that the patient is not allergic to penicillin. Are you allergic to penicillin?
No.
Okay. And then after you administer it, you need to see if they have a rash. Since this is an IM injection, you'll either be giving in the deltoid, the ventrogluteal, or the vastus lataris, sorry. Okay. So what I'm going to do is put it in the ventrogluteal, so I'll have the patient stand up and turn around and facing the hospital bed. You'll put all your weight onto your left leg. Okay. So from there, I'm going to put a V by the injection site and clean it in an outward circular motion. Okay, once I'm done with that, I will grab a syringe, and this is going to be larger with an IM injection. So you'll pull down the safety, you'll remove the cap. Okay. With an IM injection, you're going to use the Z-track method with your non-dominant hand. So you're going to push the skin and subcutaneous fat to the side, and then you'll stick in the needle with your dominant hand. You'll steady it with your non-dominant hand. You'll pull back and aspirate a little. Then you're going to push in the medication, hold for a second, and then pull it out at the same 90 degree angle that you first put it in. After this, you're going to clean it, and IM sometimes bleeds more, so you might need a Band-Aid. And that's it.